Yes. All right, welcome everybody. It's Tuesday at noon Pacific. I love Tuesdays at noon for our Navigating Aging. Really happy you're here. My name is Cheryl Matthew, and this is a service we offer through Heartfelt Organization every Tuesday to talk to our community, just support each other and all the challenges of, I'll call it aging, adulting, life stuff that's more typical of aging. And today's topic is, what is dementia and Alzheimer's, and how do you know if you have it or not? And a geriatric care manager for 30 years. How can that be? The numbers don't add up in my mind. So and what that means is I have a social work background, and I've assisted lots of people and families through the aging process. Usually it's from like when everything's going fine, and then all of a sudden something's not fine till the end of life. So that's where I roll. So today's topic again is, what is dementia and Alzheimer's, and how do you know if you have it? So I'm going to present some ideas here for a few minutes, and then we'll open up the floor for discussion, questions, answers. Some people here have concerns about it. Some people here have experience with it. Kind of all of that included. And I don't know if there's a study, but most people will say that now that the fear of dementia is the number one fear of like a health condition now. It used to be maybe cancer, but now that there's cures for cancer, most kind of cancer, lots of kind of cancer, I guess. People think, well, if I get it, then hopefully there's a cure. But with dementia, Alzheimer's, there's not really a cure yet. So, and some of the things that happen and some of the symptoms are similar to what happens in normal aging. So that's why I want to talk to you about what is normal aging and what is something to go get checked out. All right. So the first concept to understand is, when you hear the word dementia, that dementia is an umbrella term for a list of symptoms like memory loss, problems with language, or behavioral changes. So it's kind of a catch-all symptoms, right? And then there's different types of dementia. Alzheimer's is the most common. It's about 60 to 80% of the types of dementia. 60 to 80% will have Alzheimer's. The next leading one is called vascular dementia, which is when someone has strokes or many strokes. So these are progressive. They start gradually and progress over time. The difference in that is with the stroke, that usually is really fast. Someone has a stroke and their memory, language, behavior is impaired really fast. Sometimes that can come up to where they used to be afterwards. So sometimes that will return. But today we're going to really focus on the Alzheimer's type of dementia, because that's the most common. So Alzheimer's will be a slow progression. Usually when people either have it or have a loved one with Alzheimer's, when the symptoms start to become very clear, then the family looks back and goes, you know what? Like, that's been going on for several years now. And so looking back, then it makes more sense, and they could see the gradualness of the progression. So it usually comes to people's Attention is when the memory loss, language, and problem solving and thinking abilities start to impact daily life. Maybe people start getting lost, driving in the wrong direction to usual places, start forgetting names and can't remember them again. Typically, someone might be diagnosed with what's called mild cognitive impairment first, and that mild cognitive impairment is similar to normal aging changes in the brain, but it doesn't really prevent you from doing your activities of daily living and or being socially engaged. It's just usually it's the start of something more progressive, but sometimes people just have mild cognitive impairment and just stay at that level. So those are two terms you might hear: dementia, Alzheimer's, or mild cognitive impairment. So the Alzheimer's Association has a great list of 10 warning signs. And so I'm going to just go through those. And what I like about it is it helps you delineate what's normal aging and what is concerning, or what you want to probably get checked out. So number one, memory loss that disrupts daily life. What's typical in aging is sometimes we forget people's names, but usually if you wait a little while, you'll remember them. Something will go, oh yeah, and it might be later that day, might even be the next day, but usually you remember them. So also it's short-term memory. So it's things that you just recently learned that you may forget. Okay, so number two is challenges in planning or problem solving. So activities that may take more than 2 steps to do, that can be challenging. Sometimes it's taking a shower gets confusing, because if you break it down, there's so many steps involved. From taking your clothes off, how do you even take your clothes off step by step, turning the water on, adjusting the temperature, getting in the water. I mean, if you think about it, the next time you take a shower, think of how many individual steps. This also could include keeping track of your bills, like paying bills, keeping track of your checking account, baking a familiar recipe. You may not be able to get through that. What's typical is just making occasional errors when you're managing your money or your household bills. You know, that's normal. All right, number three, difficulty completing familiar tasks. So that could include driving to a familiar location, organizing a grocery list, or remembering the rules of your favorite game. A normal aging related change would be that you need help maybe using the microwave or recording something on TV, especially because things change so often, like the new apps change, and maybe you're not able to figure that out. Number four, confusion with time or place. So people with Alzheimer's can lose track of dates, seasons, or the passage of time. A normal or age-related change would be getting confused with maybe the day or the week, especially now that we don't usually write down the day too often. You know, before, like maybe when we were in school or with work, there was more writing. Sometimes I forget what day it is and I have to remember, but it usually comes back to me. Trouble understanding, so number five, trouble understanding visual images or spatial relationships. So this can lead to trouble with balance or trouble reading. They also might have trouble with judging distances, determining color contrast. Sometimes you'll notice like different patterns on a carpet may be confusing, like someone would think it's a step, or but it's really just like a dark area in a carpet. Typical or normal age-related change is vision changes due to cataracts, for example. All right, number 6. New problems with words in speaking or writing. So people with Alzheimer's may have difficulty joining a conversation or following a conversation. And you'll see this in social settings where someone struggle with their vocabulary. They may say if they're used to going to church, they may not go to church, or they may like just separate themselves from people because they have a hard time following the conversations. Typical age-related change is just having trouble finding the right word. And then we go on to choose a different word, maybe find the other word a little bit later. Number 7, misplacing things and losing the ability to retrace your steps. And a person with Alzheimer's will often put things in unusual places. They may lose their purse and then find out that they actually put it in the oven or the microwave. So they're putting it in different places, and then that can lead to accusing someone of stealing their stuff, especially as the disease progresses. I find this quite often. What's typical age-related changes is misplacing things from time to time and then retracing the steps. Sometimes I have to go back to where, like the place I remembered to go. Like if I walk from one room to the other room looking for something and I get there, I'm like, why did I get here? I have to go back to where I started and go, why did I want to go to the other room? And then it comes back to me. Number 8, decreased or poor judgment. So this could include making poor judgments or decisions with money, and also paying less attention to their grooming. What's typical age-related is maybe neglecting something like your oil change in your car, but it's minor. Number 9, withdrawal from work or social activities. So again, it's regarding the inability to follow a conversation, and people will often withdraw from their normal hobbies or social activities. And what's typical age-related is sometimes feeling uninterested in family conversations or social obligations. And those things change as we get older. And number 10, changes in mood or personality. So someone with Alzheimer's might get easily upset at home or work, and especially when they're out of their comfort zone. And what's typical age-related change is that we just develop preferences and a way of doing things, and we can become irritable if something happens that disrupts our flow. Like we've got our whole house set up to what we normally do, and then if we have a guest over, maybe that changes our flow and we get a little irritated. Okay, so that is the 10 warning signs that someone might be getting Alzheimer's. So then what? So if you notice yourself in any of those, or if you notice those things, one or more, in a friend, for example, or a loved one, what's important to do is find out if those changes are related to a treatable condition. And so it's important to go to probably your regular doctor first. Sometimes people are referred to a neurologist or a psychologist for some testing. But if you go to your regular doctor first, there's some important things that you want to rule out to see if it's a treatable condition. For example, an infection, like urinary tract infection. And these things can look the same on someone with these conditions as Alzheimer's. So these conditions can present the same. Okay, so UTI. UTI, emotional stress or depression or anxiety. Dehydration, that's a big one. Medication side effects, also a big one. Alcoholism, hypothyroidism, vitamin deficiency, such as vitamin B6. Sorry, just vitamin B, sleep apnea, minor head trauma or injury, or diabetes. So if you see that in yourself or someone else, the signs, if you go to the doctor, you want them to make sure that they do a workup of these things to rule out anything that could be treatable. The other thing they may do after ruling those things out is refer you to a mental status test, like a mini mental exam. That's like 30 questions. And then there's more involved tests that they could run as well. Sometimes they'll do neurological tests or brain scans. So right now, there is no treatment for dementia. The best we can do to reduce our risk is to make some lifestyle changes. And that includes eating a healthy diet, which means less sugar, moving, keeping your body moving and physically active is one of the biggest ones, one of the most impactful things you can do for your whole body health, but specifically your cognitive health. Not smoking, learning new things. So people used to say, hey, do Sudoku, do crossword puzzles. That's potentially it, but if you do crossword puzzles every day, you might not be learning new things. So it's just trying new things. Maybe it's a language, maybe it's a puzzle, maybe it's calling a friend, just doing something new keeps those neural pathways going. And there's other things you can do as far as sometimes it's vitamin supplements, and those are going to be individual to you and your belief system. And there's advertisements out there for things that work. There's a lot of things that don't. There's advertisements for things that are promised but don't really work. So you're going to have to use your own, intuition and testing things out for yourself. But if you do see these changes, it's important to have a conversation with yourself and be honest with those, so you can see if there is something treatable. Also have conversations with your loved ones so you can start planning for the future. And for assistance, you can always reach out to the Alzheimer's Association. They have wonderful support. They usually have a 24/7 helpline that can help you or your loved ones, as well as universities will often have memory centers or cognitive health centers within the university, like UCI, UCLA, things like that, or whatever's nearby you, if you want to get more involved testing. My experience is that the testing doesn't usually detect things, and then if it does detect things, there's not a lot that they can do. But there are some conditions that can be helped. If someone has pressure on the brain, hydrocephalus, then that pressure could sometimes be relieved and help. Sometimes people's brain, upon scans, looks like it is shrinking, like it would have Alzheimer's, but the person doesn't have any symptoms of Alzheimer's. So it's really your own path with this, if this does happen to you or with a loved one, and it's making the most of it, bringing the joy into it. If there is something, you go like, look, we have this and there's nothing to do. Let's just make the most of it. And one thing that I love lately, I've been hearing about how people use improv skills with people with Alzheimer's. So say if they're repeating the same question over and over again, then you can do, you could look this up, but there's an improv game called Yes and. So they tell you with people with Alzheimer's, you don't need to argue, you don't need to correct them, just join their world. And so if they ask you the same question, you could just get really creative with a yes and instead of a no but. Like, no, you're not, your mother's still not alive. No, you're not working anymore. That's not really going to help if someone doesn't understand. But if you can use your creativity, and it can turn into a joyful situation if you bring the humor and the loving. The loving is the most important. Apply loving to yourself and to those who might have Alzheimer's. So that's the information that I wanted to share with you and clarify some things. And I'm happy to open up the floor to questions, comments, any kind of thing that you like, just raise your hand.
Just yesterday, I saw a video that someone sent me, and I've kind of known this being in the creative arts and therapy field, but they sent a video. I'm not sure if I sent it on to you, but I will if I didn't, where they showed how music supports folks with dementia. If I
Right.
remember correctly, there was one
Yes.
person where they put the earphones on and they created music for that person, and she
Hmm.
recognized her son. And after listening to the music, she knew it was her, that the fella next to her is her son. So there's a lot of experiments and um, new things going on with that.
Yes, thanks, Bertie. That's a great point. I didn't really get into like a lot of the activities to do with dementia, and I'm happy that you brought that up. So humor is one. Music is really big. It's the music memory is stored in a different part of our brain. So they do a lot of work. There's one organization called Music and Memories. They were, years ago, 10 years ago, when they first started, they would have an iPod for participants, like people with dementia, and then they'd put the headphone on and they'd make a playlist just for them. And even when they're doing, say they're, if someone's like in a assisted living and they bring people in to play music, they'll play music of their time. And the person may not know anything, that's going on, but when they play that song, all of a sudden they're singing all the words to the song. And then it can tap them into that time, and it can open up this window of remembrance. So it can be very beautiful. The other thing that's uh, they've done research on that helps people with Alzheimer's is dancing. So it's like that creative side, right? So sometimes the dance moves, or the dancing can be healing, therapeutic, make the person calm, peaceful. Thanks, Bertie. Nancy. I can hear you. Now I can't. You're not on mute. I'm not sure why we can't hear you. Is your microphone all the way down? Hmm.
Can you hear me now?
Ah, there you
Oh,
go.
there we go. I
Nice.
have an elaborate system here that Richard set up for me that they clearly don't understand. Um, so my comment is this: in the last 2.5 years, I've been through a health process, and maybe I'll even say starting with a sort of health crisis. And so many of the levels that you read relayed to us, Cheryl, I experienced as I was going through my healing process. I'm aware. So I've tried to be very tolerant of myself because I love words. I love the English language. I use it sometimes in obscure ways. I know because I've been given that feedback. Um, and I want to be able to communicate. Um, so I've tried to be very tolerant with myself. It's just kind of in my mind, it's like, oh, that's that process right now. And I find that it heals or goes away or that I normalize, I'll say it that way, if I'm just relaxed and let it go. The other thing I wanted to say, which came to me as you were talking, was how vital for me the presence of my geriatric health manager has been, because I entered the hospital with no previous experience and not knowing what I wanted or needed. And there were times during the time I was there that Cheryl was very clear with the medical staff that what they were proposing was not in the best interest, in my best interest, and so forth. So it was that and the encouragement to keep going and so forth that made me a very fortunate person to have Cheryl and now a person named Monica working with me in that capacity, because they help immensely. There are times when I am kind of baffled about what the next step is, but I know I can go to one of my two helpers and we'll get a good course of action. So I think that's it for me. God bless us all.
Yeah. Yeah. Thank you, Nancy. It is important to have our people, our good people around us that can advocate for us because if we're confused, if we have a UTI, for example, or the things that I mentioned on the list of treatable conditions, but if we have a UTI, then we're not really aware of it and can't speak for ourselves because we may be confused. So when we have other people around us that can go, hey, you're more confused than usual, let's get you some help. That's ideal. The other thing I wanted to say about that is there are some things that come on right away. They're acute, like, hey, that person was fine yesterday, and all of a sudden they're not. Like that immediate change can be something, a stroke, but also it could be an infection. That's how you can tell, especially with Alzheimer's, it'll be slow progression typically. But with an infection or dehydration, it just comes on really fast. And all of a sudden, you're like, that person is really acting strange. So those are the two. If you end up in the emergency room with some presenting with those conditions, the first thing they're going to do is test for urinary tract infection and dehydration. Okay, John and Lori.
Hey, family.
Hey, John.
I was just enjoying Nancy sharing so much. I was thinking like just 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 recollections of Nancy and uh, like why is it that I feel comforted when I hear Nancy share? And I think it's like I know I've said parts of this before, but it bears repeating another. I'm like, I was always impressed by Nancy because Nancy had this, Nancy has this blend of humility and intelligence and competence that really, I don't know, it's like gives me faith in human beings. Um, I just,
being
yeah.
funny.
And anyway, I was just thinking about her dad and when she was her dad, like looking after him and visiting him weekly and and just but I think it's like that Nancy's, when you were sharing dealing with some things and yet it wasn't getting it in the way at all of who you are in your expression. And then of course sharing about Cheryl, our Saint Cheryl, patron saint of Alzheimer's patients, and I feel like I should have like a little medal on a chain that I wear around my neck or something, like a little brass image of Cheryl there smiling and looking relaxed. And I think one of the things that about Cheryl that was so helpful for us the most when we were dealing with a kind of the aftermath of a very surprising and challenging situation, was that Cheryl just had this sense of humor and presence that, you just kind of want somebody like this
Do more.
to want you more.
Yeah.
Yeah. You just kind of want to know that you're going to be okay. Like that's one of the things that when we visit Jeff Kelber we talked to him on the phone. Like it just sort of reminds me, oh yeah, I'm not in the final transition process or anything. Not that that's a problem, but it's just kind of reassuring. And but mostly what I want to say is just like if anybody's dealing with anything, I mean, related to any of this stuff, I just and they have any sense of panic or worry or
Panic.
yeah, some people get worried about things sometimes.
Hmm.
I, you know, it's like feel free to call us or talk to us because I just it's like way beyond like putting up with something. It's more like I just really do truly experience all of what is happening as a blessing. And that's so central to what I experience as JR's teaching. That literally everything that comes your way is for you. Especially
Now you're gonna have to look all over.
yeah, especially when we have the traveler working with us, it's just all being directed perfectly. And so the things literally did become a blessing. Yeah, yeah, like when we went on our backpacking trip and you were doing so great and you were helping us figure out things in nature and you were talking to nature and letting us know things that they wanted to share with us. Yeah. And I realized that we weren't dealing with something that was a broken thing, which is definitely like after going through the medical system, which we needed to do in order to get Lori SSDI disability. You have to kind of prove all the things that you don't really want to prove. But once we did that, say, oh, thank God that part's done, you know, we were able to find things that we could embrace as really like, wow, this is amazing things that are happening in our life because of this, things that weren't before. And so those magical, seemingly magical words from JR became actual rubber meets the road, physical, literal truths.
That's what she was doing.
Yeah.
And then I didn't do anything in here.
Anyway, we love you all and we support you and encourage you, whatever life has got going for you, there's just beautiful things down at the time and down the road from whatever it is. So God bless us.
Thank you. Thank you, John and Laura. That was refreshing and inspiring to hear your story. There is some insight and wisdom. Birdie.
I love every time I hear you, John and Lori. It's really sweet. And Nancy, I do love every time I hear your wisdom as well. And I have a question, Nancy. You mentioned a person, and I'm wondering how someone like me who has really no family in the area, and I really don't want to have my family in the area or in my life. But you mentioned geriatric senior care manager. And I know you're in a residence where that's probably part of what you've got there, but someone who's still like me still on my own, doing great. However, the thought of what you were sharing, Nancy, of ending up in the hospital really kind of still freaks me out. So having someone who is that kind of advocate, and I suspect, Cheryl and Karen, that you would be there for me. I have no question about that, even though we haven't talked about it. But you live an hour away. So, if God forbid something happens and I end up there, how is there a way to get someone who is that person? How does that work? I don't know anything about that. And my head went ding, ding, ding when you said those words of, ooh, I want one of those. So, I don't know if there's an answer to that question, but maybe the universe is getting it and will direct me where I can find somebody to support if, God forbid, something happens. And in my system, that's not going to happen, but I'm not always in charge of my system.
Nancy, that question was for you.
Well,
Oh,
it
it
was for
was.
both of you,
Yeah.
actually. I mean,
Oh,
sure,
okay.
you would
Okay.
know.
So
Both.
I'll tell you, like, there's a for anybody, that's on this call or nationally, there's a National Association for Geriatric Care Managers, people like me, and it's aginglifecare.org, aginglifecare.org. And you could go in there and you'll find a care manager, type in your zip code, and the people closest to you will show up. And usually they're social workers or nurses, and they assist people with, anything, the challenges that can come up. Nancy mentioned me assisting her as a care manager, and also another person. I don't know how you found that. I don't know who that other person mentioned or how you found them, but it sounds like Bertie wanted some insight from you as far as your ability to locate people, because if someone doesn't have quote unquote family, like blood family, or like if they're not married or have kids, like who's that person that can assist?
Yeah, I'm sorry that I was listening. I just didn't get it was my turn to speak.
That's
Well,
fine.
I've found and continue to find it very, very more than useful. It's kind of vital to my healing process and peace of mind.